All right. So how are you, by the way? I'm talking to you in a week. You okay?
Doing very well. We're held up safe at home and here with my wife and doing well.
Good.
Yes.
You all still speaking to each other?
Still speaking. And the big problem is we found out we have to wear a mask at home to keep from eating. There's no doubt about it.
Oh, I'm going to employ that at my house.
That's funny.
I've gained 5 pounds.
Me too, Dr. Kavanagh. Me too.
That's a good rule. Just wear the mask.
Yeah.
That's funny. All right. So I want to talk about the White House's response to the COVID-19 that key officials, well, you take it.
Well, I think everybody knows one of the talking points now in the media and big news items is that there's been a coronavirus outbreak within the White House.
Yeah.
And this involved a valet of President Trump. This valet was responsible for serving food to President Trump. And there was also Vice President Pence's press secretary, both of which have tested positive. And this brings up a lot of really important points, one of which is the accuracy of testing, which may not be accurate enough to assure the president's safety. And also, I think, a national security issue. Having Vice President Pence and the president in the same room with this outbreak and same setting increases the chances of both of them getting infected and incapacitated. It needs to be remembered that although this is a disease primarily of the elderly and affects the elderly worse, elderly is defined as being above 60, and both of those individuals fall into that, are also male, which is a higher risk. And I know they don't want to wear masks, they want to calm the nation, but on the other hand, we can't have our top leaders, and this includes the Joint Chiefs of Staff, which we're meeting with the president, being compromised. And this is an important issue. And those of you that think that, well, this is just a left-wing conspiracy theory, you need to realize what would happen if both the president and vice president became incapacitated with this disease. And remember, it's not just dying. There's more and more evidence out that if you become very sick or have to be in the ICU, you can have serious, long-lasting health problems. And from my understanding of the Constitution, if the president and vice president were to go out, that would put the Speaker of the House into the White House. So it really is important for many reasons that regardless of your political view, that you take this epidemic seriously and you perform proper social distancing, you start wearing masks. And this is another concern I had regarding the churches and the church reopenings. I don't know, Jack, if you heard the news that the churches are reopening and they had a court decision.
Right. That was in their favor. It was in the church's favor.
Yes, and it was in the church's favor. And I think this kind of in the viewpoint of the public tends to mitigate the problems of the epidemic because some of our leaders are still lessening what needs to get done. You know, I'm not a lawyer, I don't have a lot of legal expertise, but from reading in the lay media, I think that one of the arguments were, well, the churches are being treated disproportionately to other stores such as grocery stores. And of course, we've talked about this in the past on what's going on in the grocery stores, and I think the remedy shouldn't have been loosening what was going on in churches, but tightening and getting more strict on what's going on in grocery stores. To my knowledge, there's only one store, and that's Costco, which is requiring masks of patrons and also employees. There may be others because this is rapidly changing. But I think that, along with strict social distancing, make sure that only one member of the family goes into the store, and whenever possible, order your groceries either online to be delivered or pick them up at the store. There are some public health experts that feel that you shouldn't be even going into the grocery store, and I more side with those opinions. And certainly, if you then had that going on in grocery stores, I don't think the churches or the one church in Nicholasville would be felt as slighted or having these undue obligations to meet for this epidemic because they'd be following the same rules. If you don't go into the grocery stores, you don't go inside the church. And of course, the church, you also have the added concern of singing and even loud vocalization, which some feel can aerosolize the virus. And I feel personally that this is the reason why we've been seeing outbreaks in churches.
And also starting today, businesses can refuse customer service if they're not wearing a mask. According to the governor's press briefing on May the 3rd, this is the day that starts. And I'm sure you've seen the footage on the news of some overzealous security people that have carried that to extremes. And so it's scaring me. I mean, these businesses are now free to open if they choose, with some restrictions, of course. Construction, horse racing, no fans, manufacturing and distribution, office-based businesses, 50%, and pet grooming, boarding, photography, and vehicle or vessel dealerships can all open today if they choose to.
Well, and I agree, Jack. The key here is government isn't powerful. They can't say the economy's open, the economy's closed. If they want to open the economy, they have to make customers feel safe. And this means there has to be a buy-in by the patrons on wearing masks, because if you don't wear masks, you're going to discourage other customers from coming in. Remember, a mask is to protect the other person from you being an asymptomatic carrier and spreading the virus, rather than from protecting you from getting the virus. And they need to be careful when they reopen the economy to make sure the patrons feel safe. And right now, I don't think we're there yet.
One other question, then we got to move on. If you don't have a vaccine, the only alternative is herd immunity. Talk about herd immunity and exactly what that means.
Well, herd immunity is the theory that if enough people get infected, it will save other people from becoming infected. And that just isn't going to take place with this virus because the virus is too infectious. It's on the order of smallpox. Peter Navarro said that in a memo back in January. It's just too infectious. You'd have to have over 70 to 80% of the population immune to this virus before herd immunity would even start to kick in. And then you have the problem it's a coronavirus. You may not even get lasting immunity, and there are two strains of the virus. So that's a false hope. We really do need to concentrate on social distancing.
Yep.
That is key.
Wearing the masks, washing the hands, don't touch your face, all that basic stuff. Hey, listen, always a pleasure. Thanks for being with us, Dr. Kavanagh. We'll talk to you on Wednesday.